morning, Laura. My name is Melanie. Welcome to the Trauma Nursing Process Station. Let me go ahead and read you your pre-hospital report, then you can proceed. Okay. An ambulance is en route with a 22-year-old unhelmeted motorcyclist who struck an automobile at 45 miles per hour and was 20 feet or 6 meters onto the road. Pre-hospital personnel report the patient's unresponsive with a blood pressure of 100/60, strong pulse of 128 beats per minute, and spontaneous respirations at 24 breaths per minute. Cervical spine protection was initiated, and the patient is in complete spinal immobilization. The patient has one large caliber intravenous catheter with isotonic crystalloid solution infusing. Oxygen via non-rebreather mask is being administered, and both wrists are splinted. The patient has just arrived in your emergency department. Please proceed with your primary and secondary assessments and interventions.
All right. I'm going to begin by making sure we use standard precautions and then start with the airway. First, I'm going to do the chin lift and look into the mouth. Do I see that the tongue has fallen back? Is there any swelling or any kind of debris, blood, secretions, loose teeth that I see?
There is no obstruction by the tongue. There is no loose teeth, debris, or secretions present in the airway.
Okay, the airway is good, so I'm going to go ahead and put the mask back on, and I'm going to maintain the C-spine stabilization. Is the patient spontaneously breathing? Do I have rise and fall of the chest? Do I see any deformities of the chest?
The patient is breathing. There are no deformities that are present on the chest, and there is rise and fall. The rise is very shallow.
Okay. Do I have bilateral breath sounds?
Breath sounds are present bilaterally. They are severely diminished.
Okay. I see that there's some issues with the breathing, so we're going to go ahead and begin by ventilating the patient with a mask.
Great. The physician has decided to intubate the patient. Intubation has just been accomplished. What is your next step?
First, I'd like to see if we have good rise and fall of the chest with the ventilations.
And the chest does rise and fall.
All right. And then I'm going to listen. First, I have gurgling over the stomach.
There is no gurgling over the epigastrium.
And do I have bilateral breath sounds?
Breath sounds are present and equal.
All right. And also I could use a CO2 device to see if we have a good placement.
And there is good color change with that.
Okay, so the airway has been secured and the patient is breathing now. With assistance, I'd like to move on to circulation. Do I have a good central pulse?
Pulse is present and rapid.
Okay, and the skin, do I have, can you tell me the temperature, the color, and the moisture level?
The skin is pale and cool and dry.
And do I see any obvious signs of bleeding anywhere on the patient?
There's no uncontrolled external bleeding.
Okay. Well, I see that the patient has an IV from pre-hospital. Is it still flowing well?
It is still patent.
Okay. The patient needs a second IV, so I'm going to start another large bore catheter of a warmed isotonic crystalloid solution through blood tubing and give it at a rapid rate. When we start the IV, I'm going to go ahead and send some trauma labs down too. Okay, I'd like to go ahead and move on to disability then. What's the patient's level of consciousness?
The patient is responsive to pain.
Okay. And then when I look at the pupils, do I have any pupillary reaction?
Pupils are equal, round, and reactive to light, but they are sluggish.
Okay, so I'm concerned with a head injury because of the sluggishness and the level of consciousness. Now I'm going to go ahead and expose the patient. I'd cut off all the clothing that's not off, and then for the environment, go ahead and cover the patient back up. Okay, I'd like to move on to get a full set of vital signs.
Okay. Your blood pressure right now is 110/60. Heart rate is 100 beats per minute. Respiratory rate is assisted at 20 breaths per minute, and the temperature is 98 degrees Fahrenheit or 36.8 degrees Celsius.
Okay, I'd like to put him on the cardiac monitor right now and get a pulse ox.
The rhythm is sinus rhythm, and your pulse ox is 98%.
Okay, are there any contraindications to putting in a urinary catheter?
There are no contraindications.
Okay, we'll go ahead and put the Foley in then. And are there any contraindications into putting on a gastric tube?
There are no contraindications.
Okay, we'll go ahead and put the gastric tube in now also. Has the family been notified about the injuries yet?
The patient representative has notified the family, and they're on their way to the hospital.
Okay, can you let me know as soon as they get here so I can let them know the status of the patient? And I'd like to move on to the pain level of the patient. He's not speaking, so do we have any other signs of pain?
There are nonverbal signs of pain present.
Okay, I'd like to pad any bony prominences to relieve the pain. Go ahead and continue talking to the patient, and can we consider analgesia at this time?
Yes, a narcotic analgesic has been ordered.
Okay, we'll go ahead and give that as soon as we get that. Has there been any more information from the scene of the accident, or do we have any family history on this patient?
The additional information that we have regarding the accident is the patient actually fell on his head, and there's no additional past medical history or other patient information that's available.
Okay, I'd like to move into the head-to-toe exam now. I'd like to start with the head, inspecting and palpating the head and the face.
There are multiple abrasions and contusions present.
Okay, I'd like to put the patient on the ventilator now.
Okay.
And I'd like to continue inspecting the neck.
Okay, I will stabilize the neck while you assess.
Okay, do I see or palpate any additional injuries?
There are no injuries present, but when you palpate, you note crepitus that's between C4 and C6.
Okay, so I assume that there is a potential C-spine injury, so we'll continue with C-collar. Okay. I'd like to move down to the chest. Do I see any obvious injuries to the chest?
There's no abnormalities.
Okay, no. Palpating, do I feel any crepitus or?
No crepitus, no abnormalities.
I'd like to listen to the breath sounds and the heart tones. Are there any abnormalities?
Breath sounds are clear bilaterally, and you have normal heart sounds.
And inspecting the abdomen, do I see any deformities or bruising?
There's no abnormalities.
And I'm going to listen to the vowel sounds in all 4 quadrants.
Vowel sounds are present.
And then I'd like to palpate for masses, any rigidity.
There's no abnormalities.
Moving down to the pelvis, I am going to apply gentle pressure on the iliac crest towards the midline. Do I have any instability?
There's no instability.
And on the symphysis pubis?
No abnormality.
Okay. I'm going to move into the extremities here. Do you have any contusions, deformities, injuries that are obvious to the arms?
Both wrists are swollen and deformed. They have been splinted.
Okay. And do I have a good neurovascular status?
Yes, you do.
Okay, moving on down to the legs. Sam, do I have any deformities, any injuries in my neurovascular status?
There's no abnormalities, and the neurovascular status has no problems.
Okay. Well, now I'd like to roll the patient onto the side so I can inspect the back.
Okay. Let's ask someone to help us.
Okay. We're going to maintain C-spine control, and on the count of 3, turn him.
Okay, ready? 1, 2, 3.
I'm going to palpate down the spine to see if there's any deformities of the spine, and palpate on the back and visualize to see if there's any injuries.
There's no abnormalities.
Okay, and at this time I'd also check a rectal tone.
Great. We'll roll back. 1, 2, 3.
Okay, I've completed my exam. I've completed my exam of this patient, and I've identified that he has a potential head injury with a loss of consciousness. He has a C-spine injury and bilateral wrist deformities.
Great. Are there any interventions or diagnostic tests that you think are indicated at this time?
I'd like to do the trauma chest and pelvis x-rays. I'd like to also get a C-spine x-ray and a CT of the head and neck, and get x-rays on the bilateral wrist injuries. Go ahead and order some additional labs.
Okay. Are there any findings that need to be reevaluated?
I need to reevaluate the vital signs, the primary survey, the injuries that have been identified, and the patient's pain level.
Great. Is there anything that you'd like to add? Thank you so much.
I'm on